Does Accountability Work? Individualized Service Plan Evaluation by Kyla Beecham, dated March 30th of 2019. Professor Dr. Jerry Bean for the Social Work 7401-7402 Social Work Evaluation class. Clients served by the Franklin County Board of Developmental Disabilities require an individualized service plan to be written for them to receive services through the county board. Assigned service coordinators write the individualized service plan and need to have it turned in to the tracking department 45 days before the plan's start date, or the level of care date as determined by the Ohio Administrative Code. The individualized service plans need to be distributed to the providers working with the clients at least 15 days before the start of the plan. The intervention that was implemented was a change to the tracking sheet that required service coordinators to date when they sent the document back to their supervisor with corrections completed. 84% of the ISPs were in compliance, while 16% of the ISPs were not in compliance of the ones that used the updated tracking form. The implications of the results link service document compliance to supervisory accountability. The Franklin County Board of Developmental Disabilities functions as a school system that collaborates with 16 school districts. It is also a major employer in the Central Ohio area, including employment of persons with developmental disabilities. The Franklin County Board provides educational, vocational, and support services and funds organizations working to fulfill the board's missions. The mission of the board is to provide services and supports to eligible children, adults, and their families so individuals with developmental disabilities can live, work, learn, and participate in the community. People eligible to be involved with the Franklin County Board of Developmental Disabilities and their services include persons with developmental disabilities and their families, as well as citizens of the Franklin County, including taxpayers. The focus of this evaluation is the documentation compliance of services being reviewed by the clients of the Franklin County Board of Developmental Disabilities Service Coordinators. Individuals with intellectual and developmental disabilities need services to meet their needs that people without disabilities may not have. This makes them a vulnerable population as they are often at the hands of other people, relying on others to fill these needs for them, such as service coordinators. As a service coordinator, it is our role to ensure that clients on our caseload that all qualify with having significant developmental disabilities needs are being met. According to Burke and Heller, across the United States, more than 76,677 individuals with intellectual and developmental disabilities are waiting for services. This holds true within the agency, as many of the clients have needs that are not being met. Understanding organizational characteristics that contribute to the management of current workloads can offer those in the welfare arena possible avenues in dealing with the current workload crisis. This evaluation takes into account the supervisory level of the service coordinator with the resources supplied, while also looking into the accountability in the program. Variables that are empirically linked to positive employee outcomes include the supervisory support, availability of resources, and worker ability. The studies have supported that employees will be better able to perform their jobs and turn in their documentation with an availability of resources. They have referenced many articles in their systematic review of services provided in the welfare industry. If the resources and supervisory accountability are not available to service coordinators, clients receive services that rate more poorly and that make a difference in the quality of services. The systematic reviews have supported the involvement of supervisors being involved in the documentation process. The theories that guide this evaluation include administrative and supervisory intervention on service employees. The data from the study shows that supervisors can make a positive impact on the outcome of the process the welfare agents progress. The evaluation addresses the problem of ISPs being turned in late, making them no longer in compliance with state rules. A major part of the service coordinator's job includes creating and monitoring ISPs. Effective service plans have individualized, measurable, time-focused goals and a list of action steps to assist clients in reaching their goals. The Franklin County Board of Developmental Disabilities has implemented person-centered planning in the writing of the ISPs so that the goals align with the wants and needs of the clients. Research is not common in the field of service coordination and with individualized service plans. Using the information gathered from a child service agency, they found 4 strategies in improving service plans. The strategies are to have staff transparency, teaching as opposed to auditing, ongoing training, and sharing data across the agencies over the service plan data. It was found to be difficult to have these strategies implemented as the papers discussed the sensitive nature of the cases and the data that would need to be shared. Financial resources are lacking, and caseloads are too large to maintain, which are the two largest barriers in limited research on documentation process in the service plans. The service coordinators at this agency carry caseloads of around 45 clients, and the service coordinators are expected to meet the needs of the client, to meet with the clients at least 4 times a year. Service coordinators work with individuals with disabilities, and a study has shown that individuals with disabilities on your caseload increases the amount of contact made between client and case manager than with clients without disabilities. This can be an overwhelming amount of work for a service coordinator and can contribute to plans being turned in late. Individualized service plans allow for clients to receive services and become very important when clients are receiving paid supports. The plans need to be processed for their paid support to be funded, and late plans mean that the client will not have access to the needed supports. Some of the supports include adult day support and employment supports, which are used by a majority of the clients served by the Franklin County Board, and is often paid for by Medicaid and waiver funding. Without the waiver funding that is approved with the submission of the ISPs, these clients will be unable to have adult day supports and employment support, which can lead to unsafe situations for the client. The supports have been put in place for the clients to be the least restrictive measures to ensure the client lives a fulfilled and happy life. The intervention took place at the Franklin County Board of Developmental Disabilities Service Coordination Department. The participants included 2 supervisors and the service coordinators that they supervise. The intervention includes adding a supervisor check on the tracking sheet to give the supervisor more accountability on the document being turned in. This would tell when the supervisor sent back revisions of the document to the service coordinator. This evaluation was a program-level evaluation. The target problem being addressed is individualized service plans being turned in late. They need to be turned in 15 days before the plan is supposed to be implemented for the client. The intervention is using the online portal to track when they are turned in and changing the tracking sheet to include when revisions made by the service coordinator were turned back into the supervisor. The possible solution is that the implementation of the change on the tracking sheet will allow for ISPs to be turned in on time, so less paperwork will be turned in late. Currently, there is a form that is used to track when ISPs are turned in and at which level they are turned in at. The intervention was changing the form to give the supervisor more accountability by including the date that they return the ISPs to the service coordinator with their revisions. The use of the online portal where the ISPs are electronically uploaded tracked dates to discover that decreases the amount of late service documents being turned in. There are no treatments in place since this is a program level and administrative evaluation program. There are rules and procedures such as the 15-day rule for documents being turned in 15 days before the service is implemented. Also, the administrative department fills out a tracking sheet to keep track of who had the documents and at what dates they were completed their part in the progress. This intervention was completed at the agency's office and mostly on a computer, as this information is kept digitally. The intervention took place November 20th, 2018, when an updated version of the tracking sheet was sent to the 2 groups of service coordinators involved in the evaluation. This is a quasi-experimental comparison group design with a post-test only comparison group design. This will allow for the examination of differences between the participants who received the intervention and those who did not, as the directors would not allow for the intervention to be used by every service coordinator. The dates were documented in an Excel spreadsheet and compared to the results to the findings of the study from last year. This year, the change of adding a step on the tracking sheet was implemented. The measurement tool is a pre-existing tool that is being used solely by the Franklin County Board and is an online tracking tool, measuring dates and deadlines. This tool is unique, and reliability has not been measured externally. This is the second time data will be collected with a cross-sectional survey and with this measurement tool. This measurement tool is being used because the Franklin County Board has strict rules about the evaluations done, and this will have a better impact on the reliability of the evaluation. The measurements include the dates of submissions, the types of services used by the client, and the department type. The item being measured needs to have a definition that is carefully designed. Since there is a clear definition of what will be measured and studied, this leads to mark the reliability of the study. Researcher bias should not be able to interfere with this project because the evaluator just documented the dates and did not have the ability to change the findings as they are timestamped and recorded internally within the agency. The clients and service coordinators are also split into different departments, with them receiving different types of services, so this will also support the reliability as it is not comparing different types of service coordinators' caseloads. With this measurement tool being internal to the Franklin County Board, the validity has not been tested and is unknown. The focus of this project is the intervention of the tracking tool, which makes internal validity the most critical part for this project. In terms of external validity, the service coordinators being evaluated each have a caseload with around 35 to 45 people and have clients with different needs and levels of care. The data was collected from ISPs turned in between November 20th of 2018 to March 20th of 2019. There were 2 teams of service coordinators using under the supervision of 2 different supervisors, each with a different caseload. The agency will not allow for some information to be disclosed, such as age, gender, diagnosis, and marital status. The only information allowed to be disclosed are the ISP's band-aids and type of waiver they use, and whether they are adult or a child. There were 100 samples of ISPs taken, which include 60 adults and 40 children, with 5 different types of services being provided. The types of services include independent options, level 1, and traditional, being separated between adult and child cases in each category. Each client is receiving services through the Franklin County Board of DD. Clients were not directly involved with this evaluation, as this was a program-level evaluation that tracks the dates of the documentation submissions. The dates and data were logged in a spreadsheet. The dates collected were the outcomes measured with using 0 and 1 as the measurements, for 0 meaning the document was late and 1 meaning the document was turned in on time. 100 individualized service plans were tracked over the course of the past semester. 2 supervisors implemented the tracking sheet change and required their service coordinators to use them when turning in the ISPs. The groups were split into adult IO waiver, adult level 1 waiver, adult traditional with no waiver, child IO waiver, and child level 1 waiver. Each group had data collected on 20 ISPs and the submission dates. It was expected that individuals who are not receiving waiver services would have their documents submitted on time more often than clients who receive waiver services, but this was not the case. The logistic regression analysis showed that age and waiver type were not significant indicators of the timeliness of the ISP. The groups were based on the service coordinators chosen to use the updated tracking sheet for the ISPs. The 2 supervisors were chosen by one of the directors at the agency to implement the change in their teams of service coordinators. The groups included 5 types of clients and show that some of the groups have a different submission rate than others. The types of waivers indicate the services a client may need, with an IO waiver being the clients with the most needs, with fundings range from $5,000 up to hundreds of thousands of dollars. Level 1 clients use around $5,000 of funding each year to pay for additional services. Traditional clients do not need extra services to be paid for through waiver funding. 84% of the ISPs were in compliance, while 16% of the ISPs were not in compliance, of the ones that used the updated tracking form. The compliance is regarding the Franklin County Board's compliance rule of having the documents submitted 15 days before the start of the level of care date or the new span date. This data was compared to the data taken last year, with no intervention being implemented in the last year. The data from last year showed that 57% of the ISPs were in compliance with the state's rule. This means that there are a 27% increase in the amount of compliance with state rules in the submission of the ISPs at the Franklin County Board. The average time an ISP was held last year by supervisors as the first step of the ISP process was 13 days as opposed to 7.5 days this year. Dates that were not studied included how long the tracking office had the document and how long it took to mail out the document. If a service coordinator submits the plan past the 45-day deadline, then it is 9 times more likely that the plan will also be mailed out late, regardless of age or waiver type. The sole predictor of compliance speaks to the diversity within the Franklin County Board. Each service coordinator has a unique style. Each client has a unique number of people, and each client served by the agency has a unique set of needs. Some large teams can have a quick turnaround between meeting and returning signatures, while some parents are nearly impossible to contact. One key factor in the limited research has been done in this area that compliance is too difficult to operationalize. How does an agency know if they are following the rules set out in policy? How do you measure the quality of service plans? In this case of the project, numbers and dates were simple to operationalize. Despite its ease of understanding, simple numbers do not provide insight into the gray areas. Quantitative data is black and white and thus misses out on key descriptive factors like staff or consumer input. Human service exists in the gray area. Personal circumstances arise that may not be captured in this evaluation. One recommendation for the agency in the future is to balance the quantitative data with a qualitative evaluation of agency records. Instead of guessing or trying to predict trends, administrators could go straight to the source and evaluate what is going on that they did not get captured in the numbers. Other relationships could be examined, like team size, caseload of the service coordinator, or individual factors of the client like specific age or race. Due to time constraints, progress notes could not be reviewed. Agency structure prevents surveys from being passed out to staff or to clients in the office. However, these qualitative measures could be used in the future to get a greater understanding of the story behind the numbers. What common reasons make service coordinators feel that they cannot submit ISPs on time? What mistakes do supervisors observe in the ISPs that could be addressed by an updated tracking memo and thus cut down on editing time of service plans? Research on deadline compliance in social service agencies outside of the Franklin County Board is very limited, so it is difficult to say if the results of this evaluation are unique to the agency or consistent with similar agencies. One likely explanation is that the agencies do not want to broadcast their problems so that they can maintain their image within the community and among stakeholders. Compliance reports are likely similar to this evaluation project. They are specific to the roles of the agency and are protected by higher-level administrators. Unfortunately, it makes this difficult to acknowledge and address the problem because it is kept down low.